Assalamualaikum and hi everyone. My name is Alia Yasmin and today I'm going to summarize the newspaper article for my group. So today we are going to discuss on how e-cigarettes tax revenue is going to be used to pay for healthcare workers. The Bandar Kuching MP Dr. Kelvin Lee has called for funds collected from the proposed excise duties on e-cigarettes or vape liquids containing nicotine to be utilised towards providing healthcare workers with fair wages. He highlighted the need for extra provisions to look after healthcare workers who are increasingly burnt out, worried, fearful, and disappointed with the healthcare system. A COP poll revealed that 70% of government healthcare workers were considering leaving their jobs due to work burdens, understaffing, unfair pay, and insufficient amenities and equipment in public healthcare facilities. Dr. Yee, who is also a special advisor to Health Minister Dr. Zaliha Mustafa, believes that the Syntax Fund should be used strategically to reinforce primary care and address issues such as non-communicable diseases (NCDs). He welcomes the allocation of 50% of the tax collected for vape products to the Ministry of Health (MOH), but stresses the importance of stemming the leakage of funds and reducing wasteful spending on healthcare. Dr. Yee believes that proper management and allocation of resources are crucial to improving the healthcare system in Malaysia. He proposed three strategies for the 2023 budget, which is prioritizing prevention, primary care, and preventative care, increasing tax relief limits for curative health services, and directing funds towards structural reforms. His first proposal is to prioritize prevention, primary care, and preventative care, while his second proposal is to increase tax relief limits for curative health services. He highlighted the need for a larger amount of funds for structural reforms in the healthcare system, especially given the uncertain state of the economy. The Health White Paper is of utmost importance as it provides a roadmap on how to reform the system and how to efficiently utilize funds. He also emphasized the need to address the social determinants of health, such as smoking, to tackle congestion in hospital and healthcare facilities. Dr. Yee also welcomed Prime Minister Anwar Ibrahim's plan to introduce the Control of Tobacco Product and Smoking Bill 2022 to reduce hospital congestion. That's all from me. I will pass to the next presenter.
Assalamualaikum, my name is Muhammad Fahan and I will continue with the next part, which is isu. The e-cigarette taxation has been a topic debate in many countries, including Malaysia, with the introduction of e-cigarette tax also has raised several issues that need to be emphasized by the government of Malaysia. The first issue that has been identified is smuggling of e-cigarettes. Smuggling of e-cigarettes can occur when the tax on e-cigarettes in one nation is higher than in another nation. Higher taxation imposed and regulation can lead to illegal trade and smuggling. If the e-cigarette tax is excessively high, the high price of e-cigarettes will drive the low-income people to buy and get e-cigarettes illegally on the black market. This can result in revenue loss for Malaysia government and also a decrease in the effectiveness of the tax policy. Another issue of introduction of e-cigarette taxation is it will increase the government cost. What exactly is meant by increase the government cost is that there is an increase in the number of people admitted to the hospital as a result of taking illegal e-cigarettes. Illegal and smuggled e-cigarettes may also pose health risks as they may not meet safety and quality standards. This also can potentially harm the consumers in getting the smoking related diseases, which also can further increase the healthcare costs in treating them. Like the government need to spend more on buy the right medicine. Other than that, the issue coming on by Malaysia's implementation of e-cigarette taxation is uncertified e-cigarettes product. Each company business seeking to produce and sell e-cigarettes product in Malaysia must first get clearance from Ministry of Health or MOH before it can be sold to the public. Therefore, there will be parties who will take advantage by not registering their e-cigarettes product with MOH to avoid paying for the tax, which the product produced may does not have the right certification. For example, uncertified e-cigarette product like the e-cigarettes liquid may contain substances such as heavy metals, formaldehyde, and other toxins, which also can be very harmful to the consumer's health. I think that's all from me. Thank you.
Assalamualaikum, my name is Azmin Ifami Ismaino. In the article, it mentioned that the fund collected from the proposed excess duty on e-cigarette or vape liquid containing nicotine to be utilized toward providing healthcare workers with fair wage. So, we will be discuss about the implication if the fund collected will be utilized toward providing healthcare workers with a fair wage. So, with this, there will be a smuggling to supply vape liquid to the community. If there is a smuggling activities, it will cause a tax revenue loss for the government, and the smuggling of vape liquid will increase where it is also implicated in many health related issues. So other than that, e-cigarettes are a relatively new tobacco product that has been sold in Malaysia. Empirical research has confirmed that e-cigarette can cause irreversible lung damage and lung disease and are linked with a high incidence of smoking-related disease such as shortness of breath. So other than that, the liquid that has been smuggled may be not fulfill the requirement that must be followed according to the Ministry of Domestic Trade and Cost of Living requirements. With this, it can also create a massive problem not only for the government but also for the public health. After that, the use of e-cigarette appears to lead to substantially higher costs and access of use of healthcare service in Malaysia. Vaping is like cigarette smoking where it is highly addictive and will increase cardiovascular risk. The burden of government hospital from the admission of patients suffering the aftermath of smoking cigarettes is overwhelming. The government use taxpayer money is obliged to buy expensive drugs to treat this condition and many others. With this, the health costs will increase. If the cost of medicine in this country is estimated to increase continuously, most of the people of this country may not be able to afford it and to get treatment in the future. So that's all from me. Thank you.
Assalamualaikum to my lecturer and my fellow friends. My name is Nukrato Ain Batrisha binti Muhammad Johari. So today I want to explain about public finance topic or theory that related to the issue of the news. Following the first issue, the smuggling of e-cigarettes related to taxation can be attributed in Chapter 6 of the taxation system. A tax is a financial charge or other levy imposed on an individual or a legal entity by the government. The compulsory payments associated with certain activities. Taxation are used to purchase the inputs necessary to produce government-supplied goods and services or to distribute purchasing power among citizens. Tax revenue is the lifeblood of public finance. Taxes fund government development and social spending and help maintain employment and economic growth. The next issue we can relate to from Chapter 5, which is the government budget. According to Langfield, Smith, Thorne and Hilton 2012, budget is a detailed plan that shows the financial consequences of an organization operating activities for a specific future time period. It acts as a financial model that summarizes future operation and is usually viewed as a core component of an organization planning and control. The last issue we can relate to is uncertified product. Studies show many counterfeit, unapproved or unauthorized products are likely to be produced in unregulated facilities with unverified material that pose serious health concerns to consumers. That's all from me. Thank you. I will pass to the next presenter.
Hi, my name is Narsha binti Mahdi.
The
first recommendation is government should hire a special task force that should be set up under the Home Ministry to focus on the illegal cigarette trade. This independent special task force should comprise clean and high integrity senior representative for relevant government departments and agency to increase strategic level coordination of effort to reduce the impact of the illegal cigarette trade on public safety, public health and fiscal policies. In addition, the main task of the special task force will be to spearhead more effective coordination and collaboration among key law enforcement authorities such as Royal Malaysian Police, Malaysian Maritime Enforcement Agency and Domestic Trade, Cooperative and Commercialism Ministry, Bank Negara and Malaysia Anti-Corruption Commission. If need be, it could include local and international enforcement agency to increase cross-border collaboration and information sharing, and also support the development of multilateral initiative to tackle on tobacco smuggling. And also, enforcement should be directed at significantly disrupting distribution supply lines of the illegal cigarette trade, stepping up security surveillance, apprehending key figures, and seizing the proceeds of criminal activity, which will support successful prosecution. For the second recommendation is imposing a tax on e-cigarette product is one strategy that could be used to limit youth access to e-cigarettes. It is expected that increasing the price of this product will dissuade a portion of youth use since they are disproportionately affected by this price increase because of their lower purchasing power. Furthermore, it is well established that this strategy has worked with traditional tobacco products, and we can reasonably expect that it will be effective for e-cigarettes as well. In addition, taxation on not only could reduce e-cigarettes use among youth but also generate revenue for the government, and which may be used to cover the increased healthcare costs incurred by the smokers. The third recommendation is implementing an e-cigarette tax can help to reduce the use of uncertified e-cigarette products by making them more expensive and less desirable for consumers. The revenue generated from the tax can also be used to fund public health campaigns and educational programs to raise awareness of the risks associated with using uncertified e-cigarettes. Additionally, the government can work with regulatory agencies to establish and enforce stricter standards for e-cigarette products, which can further reduce the availability and use of uncertified products. Last but not least, licensing is used to regulate professional practice and business operations and represent one strategy to control the rising of e-cigarettes among youth. In general, in the case of tobacco-related licensing, a business is authorized to manufacture, distribute, or sell tobacco product as long as it complies with all relevant laws. Typically, tobacco-related licensing requirements for retailers or manufacturers helps to prevent evasions of excise taxes, ensure that licensees comply with tobacco-related laws, and promote safe manufacturing practice. Moreover, repeat violators or relevant laws may subject to suspensions or permanent revocation of their license, an outcome that provides a strong incentive to comply with existing requirements. As in the conventional cigarette industry, licensing of e-cigarette retailers and manufacturers is designed in part to prevent the use of these products by youth and facilitate safe manufacturing practice.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Akila Najila binti Muhammad Sri, and I will explain about the last part, which is conclusion. E-cigarettes are considered an effective alternative to conventional cigarettes. However, it is argued that e-cigarettes contain nicotine and other harmful products such as acetaldehyde and formaldehyde. All e-cigarettes products should be subject to taxation as the policy is likely to have the most impact on people e-cigarettes use. Additionally, it provides the greatest potential for financial gain. Regardless of your nicotine level, including nicotine-free liquids, all e-cigarettes liquids should be subject to taxation. By adding additional regulatory measures to e-cigarettes, the effectiveness of taxation scams can be stretched. That's all from our group. Thanks for watching.